Taking care of each other and normalizing the act of asking for help can improve a person's mental health and in doing so perhaps save their life. In our Sunday morning spotlight, Daniela Cato profiles a group working to make suicide prevention in Wisconsin a priority.
I didn't know the things I knew now. I didn't know that I had an illness that could be treated by a doctor.
Gina Orlando is a proud member of the American Foundation for Suicide Prevention.
It wasn't that I wanted to die, I didn't want to be in pain.
The largest suicide prevention organization in the country. She holds the current position of director of the Wisconsin chapter.
So how's your day been today?
It's been good.
Yeah?
Really good meetings and just really excited to be back here with our advocates.
We tagged along on their 5th annual Advocacy State Capitol Day, sharing their personal stories.
I wear this bracelet that says, "In our hearts forever." I've worn it for 10 years.
Good morning, thank you.
And pushing for millions of dollars in funds to keep life-saving programs alive.
Wisconsin supports the number 988, but from a national level, we are in the bottom third of call responses from in-state people.
According to the latest data registered in 2020, the CDC reports that suicide is the 10th leading cause of death in Wisconsin, the 2nd leading cause of death for ages 10 to 44. But Beverly Goldberg says mental health can affect anyone at any age.
When our daughter passed away in 2013, there were several deaths by suicide on the North Shore of Milwaukee.
That year, she joined forces with Orlando as volunteers of AFSP and eventually helped establish the Wisconsin chapter.
If you were looking at Abby on the outside, you saw a vibrant young lady who was a state-ranked swimmer at the age of 12. She was very musically inclined. I would say our friends and neighbors were very surprised, as we were, that she just struggled with depression and anxiety, and she, at the end of the day, did not see herself as other people saw her.
Abby is the youngest of 3 siblings. Goldberg says her then teenage daughter struggled with peer pressure and bullying.
You know, we talked to her about it, and she said, I would like to go see a therapist. I would like to go see a nutritionist. So she was all in on, you know, her care. The frightening thing is she started struggling in October, and by July, she was gone.
Having gone through a similar path of darkness herself,
I had an attempt at the age of 13.
Orlando says it took her about a decade to realize her purpose.
And that was the first time that I heard the phrase suicide prevention. That changed my life.
Today, she aims to be a voice of hope.
That we're working so hard to try to get people to understand that stigma keeps people from getting help. It takes strength to reach out for that help.
And so does asking a loved one if it's crossed her mind.
It's really important to ask, do you have ideation of suicide? Are you thinking about suicide? People don't want to ask that, and you don't think that's a normal question to ask, but if you normalize it, people feel more comfortable about that. It's been 10 years, and you think, you know, they say time heals, but time just gives you a reason to work your way through it and learn more about, you know, helping other people.